Heart attack versus angina. Technical term for heart attack: myocardial infarction. Myo, muscle; cardial, cardiac, i.e. heart; infarction, death. So of the three types of muscle that are, cardiac muscle is one, and that's solely confined to the heart. So death of the muscle tissue of the heart, myocardial infarction. We've got to appreciate in both contexts, angina and myocardial infarction, what's happening, a little bit of the pathophysiology. So let's appreciate the heart. It's a muscle. When muscles are working, there is a demand for oxygen and nutrients. So the greater the exercise level, the greater that demand. Now, the heart muscle is continually beating at 72 beats per minute in the average healthy individual. When we exercise, the heart rate goes up, so the demand for oxygen and nutrition increases. Okay. The blood vessels that supply the heart itself are known as the coronary arteries. Coronary arteries of the heart, commonly referred to as coronary arteries. If there is an occlusion in these arteries, then the blood flowing to that area of the heart is no longer being met. The occlusion can be complete or partial. That obstruction, if it's complete, there's no blood flow rich in oxygen and nutrition, so that causes the heart muscle to die. That's infarction. This is irreversible. Angina, on the other hand, I'm referring here to stable angina. You go to exercise, heart rate increases, demand increases, and what happens is there's a partial occlusion in these arteries. So as much as blood is still flowing, however, the respiratory demand is not being met, and that causes the muscle to tire. That's what we refer to as ischemia, ischemic pain, or ischemic changes. This is reversible. So when the patient rests, heart rate comes back down, respiratory demand normalizes again, and lo and behold, the pain then dissipates. Nitrates, GTN spray, widens the blood vessels to increase the blood flow to the area, and therefore increasing the oxygen and nutrition that is meeting the respiratory demand. And that's how we clinically determine between angina and a heart attack as well, or one of the many ways in which we do this. So there you are. Myocardial infarction is irreversible, angina is reversible, it's ischemic pain, and the analogy for ischemia or angina is that of a stitch. When you're exercising, you feel the pain, you stop exercising, the pain disappears. This is precisely the same. That too is ischemia or ischemic changes as per the pathophysiological theories that are. Thank you for watching.